Good afternoon, everyone. It's sorry about a minute late for our noontime start, but welcome to our media briefing for Wednesday. Thanks for joining us. Let's get going. Let's start with our CAO, Charles McKee, who I see is on the line, who can give us a welcome and get us going.
Thank you. Excuse me. Thank you, Maya. I don't know how many of these we've done so far, but I think that they've been a great success as far as getting some information out. Obviously, each media outlet has different questions and different issues they want to address, and we're trying to be as broad-based as we possibly can. Maya pulls in a different lineup as best she can each day, Monday, Wednesday, Friday, not each week. And I know a lot of media outlets focus on kind of the important issues that Dr. Moreno brings up about new tests, new cases, new positives, and trends and things like that. And we think that's really important. Of course, we also think it's important to try and address some of the other issues and resources that are out there. For example, you're going to hear today from our head of our libraries, Hillary Thayer, to talk about some of the issues from the library's perspective and what they're offering in this time of shutdown. So we appreciate the more that we can get some of that information out so that the public understands some of the resources that are available to them in this time. And the media is critical to help us getting that information out to the public overall. I don't have a lot more to report at this point as far as any specifics that are that I'm aware of that hasn't been reported on or discussed recently. So with that, I will turn it right back over to Maya and be available for questions.
Thank you, Charles. Then let's go to our most popular public health officer, Dr. Ed Moreno, with an update for today. Hi, Dr. Moreno.
Good morning, Maya, and good afternoon to everyone that's on the Zoom meeting today. So I'll just start by saying that we, in this pandemic, we know that it has caused a lot of social, emotional, economic disruption, and because of the threat it poses to public health and the stress related to folks being concerned about possibly becoming infected and getting very sick. So the shelter-in-place order is the major mitigation strategy that we have to slow the spread of the disease until hopefully we have a vaccine and we can start vaccinating folks who are at most risk of everyone, but particularly those who are most risk for getting serious complications of COVID-19. The shelter-in-place order appears to be still appears to be working, and that the social distancing and the staying at home is slowing the spread of the virus. We continue to have more cases, but it's spreading slowly. So I've mentioned that when we had our first few cases, the numbers doubled the first few days or first week, and then as social distancing took effect and shelter-in-place took effect, we were able to get the doubling time extended to about 6 days. So rather than the numbers doubling every other day, it took 6 days for the number of confirmed cases to double in Monterey County. And we've been able to look at estimate the doubling rate since then. And currently, the doubling rate appears to be about every 14 days. So that means that rather than doubling the number of cases every 6 days, of confirmed cases, the number of confirmed cases is doubling about every 2 weeks. So that's another indicator that the shelter-in-place order is effective in slowing down the virus, and it's only as effective as the compliance with the residents of Monterey County. So that's good news on that I have to share. The shelter-in-place order is the current order ends May 3rd, and that's aligned with our neighboring counties as well. And I'm frequently asked what's next, what happens May 3rd and then May 4th. The shelter in place is effective, but again, as I mentioned, it causes some disruption to society. So in an effort to try to address those impacts and economic impacts, I am continue to work with my fellow health officers, and we have regular meetings with the state health officer and her staff on behalf of the governor on what direction the governor intends to go. I'm hoping that before May 3rd, I'll be able to share some information of what happens May 4th. So, but whatever that next order looks like, I very much like it to be as much as possible aligned with the governor's health officer order, and because the governor can, I can put more restrictions in the governor, but I really can't have fewer restrictions that's in the governor's order. So that it'll be important to see what the governor's, any new information that comes out of the governor's office on follow up to his executive order and state health officer's order. And I also want, for consistency purposes, to work closely with our neighboring counties and their health officer orders because of the number of people who live and work in more than one county. So we're still working on that and having good conversations about that as well. As far as testing, our public health lab continues to perform most of the testing in Monterey County, but each of our hospitals now is either has begun testing in their own hospital, or will very soon be testing in their own hospital. So that's good. So that will complement or add to our CDC validated testing that we have here in the Monterey County Health Department. We are still continue to report by demographics, and we have most of the cases, confirmed cases, identified in the Salinas area. One thing I want to point out is some of you have recognized, and that information about the total number of cases, the total number of confirmed cases, and the demographics, some of the demographics depend on testing ability. So I can tell you, and who's testing. And so I can tell you that Salinas, unlike the other areas, does have 2 hospitals, and those 2 hospitals are submitting together more than specimens than the other hospitals in the county. So the other counties are submitting, and we are very happy that they're still swabbing and sending us specimens. But a lot of specimens are coming from those 2 hospitals in the Salinas area. So we would for that reason, that's one of the reasons why we would expect to see more cases, confirmed cases in the Salinas area. We have, as of yesterday, 150 cases and four fatalities related to COVID-19. And we continue to interview every confirmed case. And from those cases, we identify people who are contacts, and sometimes and often we work with the employers that help us identify contacts. So we've identified over 725 contacts, and we reach out to every one of them, and most of them we can get in touch with, and that's really important that we continue to do this, because this is how we contain the virus here in Monterey County, by informing people who may be infectious to stay at home, to isolate or quarantine themselves, so that they don't spread it, continue to spread virus in Monterey County. So we continue to do that, and as we get more cases, we'll continue to reassign staff from elsewhere in the health department to our disease investigation unit to increase our capacity to continue to contact all cases and call upon everyone who's identified as having been exposed. We do have a need for more testing, though, because, and I'm glad the hospitals are now coming online, because more testing would provide better data for our epidemiologists to use to determine or estimate the prevalence of the virus in our community. And that's the type of information that we would like to have, because it also guides public health in deciding the amount and extent of restrictions to businesses and activities in Monterey County. And so I do recognize that there is a need for for increased testing, and I'm hoping that that we are able to get our nation comes together and is able to provide more testing capacity in Monterey County and throughout the United States. Let's see. There is also a health officer order that's being issued in Santa Cruz County for face coverings. I've been continue to work with the health officers in San Benito and Santa Cruz counties in looking at face covering orders. And so they've announced that they will release, or maybe they have already released, their Santa Cruz County health officer order for face coverings. I can share that the Santa Cruz health officer and I, and the San Benito health officer have been looking at a template, the same template from one of the Bay Area counties. So we're all working on the same template, and I think it is probably necessary to issue the order in order to provide clarity to Monterey County residents as to what the benefit is of covering our face when we have to leave our house and be around other people that don't live with us. And so I'm working on that now with County Council and making sure that everything is in order for that. And we should have some consistency in face covering orders and practices here in our Tri-County region. Let's see. And I think that's, Maya, I think that's all I've got, and I can take questions whenever you want to, whenever you're ready. Thanks.
Thank you, Dr. Moreno. Let's move on to Gary Millay from OES for any updates he might have there.
And good afternoon, members of the press. The EOC is moving full speed ahead. As you know, we have multiple housing and care options at the present time that are underway. We are moving forward with our alternate housing plan that includes the use of hotels, the fairgrounds, trailers at various locations around the county, and a site that we are negotiating currently in the city of Salinas to isolate and house people that either are high risk or that have tested positive or are awaiting test results for COVID-19. Addition to that, and simultaneously, we are working on the development of an alternate care site at the Marina Airport that is an extension of the hospitals, where patients will be removed from hospitals and transferred to this location to prevent their capacity issues when the surge of patients happen at those facilities. The hospitals are all in coordination with each other, so that this is only going to happen when all 4 hospitals have reached capacity and are at their surge levels. And they will be active participants with the county and the state for resources to staff those facilities. On the item of trailers, that seems to be a hot topic. The county received its first allotment of 15 of our requested 100 trailers last week. And we were told, even though the communications from the state was not the greatest at first, we were eventually given the message that this was just our first allotment, that because of the difficulties the state was having purchasing the trailers, transferring the tax, and the title, that it takes a little while, and that we would eventually get our full allotment of 100, but no ETA was given on that completion of that process. although we are expecting another allotment sometime this week or this weekend, although I have not been given any more specifics to that other than that information. And if it holds true what happened the first time, I'll probably be notified when they're on their way, which is not the greatest, but we'll take them any way we can get them. The county is also collaborating with the agricultural industry to address what we anticipate is going to be a surge in COVID positive patients from that community of people. We are working actively to implement our multi-tiered plan. We already have the San Lorenzo Park situated with some trailers. We're going to expand that. We're also going to expand our planning efforts to include the Salinas Valley Fair, if possible. That's in the very beginning stages, so we haven't started negotiating yet. We're early in the planning process, but we would like to replicate what we're doing at the Monterey Fairgrounds there, so that any of the overflow patients that the agricultural industry cannot house and that we have to isolate as a county, we have the means to do so. Let me see, we're still, as I mentioned, negotiating the Salinas site. At this point, it looks like it will be either one of two sites in central Salinas. So once that is negotiated satisfactorily, we can make that announcement to everybody that it's a done deal. With that, I'll offer any questions that anybody has of me.
Thank you very much, Gary. We'll hold questions until the end. I hope you can stay with us. Let's.
Yeah, I can't. I have to leave at 12:30. So I'll go ahead and look at the chat right now for the next 10 minutes. If anybody has any specific questions they want me to answer, I'll try to answer them in chat.
Thank you very much. I appreciate it. Let's move now to Chris Donnelly, who's our Workforce Investment Board Director, who has some more information on and a snapshot of employment issues at this time. And I am not hearing Chris. So I'm going to see if I can get Chris in a different way and find out what his cell phone number is to try to unmute him from here. Is Hillary Thayer still? Are you on the line? Are you ready? Can you tell us more about how the library is faring during the shelter in place and the creative things you are doing?
I am ready. Am I able to screen share?
Yes, please.
Okay, let me go ahead and screen share with you. Thank you all for giving me a few minutes today on behalf of your Monterey County Free Libraries. Let me just shrink this window down and start slideshow. So first, I'm here on behalf of Monterey County Free Libraries, who you may normally know as 16 branches and 3 bookmobiles spread all around the county. I wanted to share that even though our physical doors are closed, every other door is wide open to the public. We are here to serve. Among the services that all of our residents can access right now for free, we have live online tutoring, kindergarten through college, and that is 7 days a week from 10 a.m. to 11 p.m. This is a chat function. They can share a whiteboard, they can share worksheets, and this is live, so they're working with a tutor, a specialist in their subject. We have download ebooks and audiobooks. ZipBooks is a program where we can deliver physical books right to your door. They get mailed from Amazon. So we can offer that via our libraries. For anybody who didn't have a card before we closed, we can offer an instant e-card that you can get right on our website. It gives you instant access to all of our online resources. We're doing virtual programs, and we have live phone assistance 6 days a week in English and Spanish. So those with a landline who don't have connectivity or a cell phone can just call us, and we will be happy to assist over the phone. We can also do community referrals on this line and help people navigate to their next step, whether they need to reach out to the city they live in or get connected to another service. We are answering questions on text and chat, and all of our branches still have their wireless on. The wireless is on 24/7, and it is very robust and strong wireless. So people who need wireless for school or for work and don't have a strong connection at home or any connection at home can drive to one of our branches and, sitting in their car outside, access our wireless connection. So that's all up and running right now to everyone in the county for free, and we'll set you up right away. I did want to take a few minutes to talk about a service the library is doing for this crisis. We are producing masks in a workshop, both 3D printed masks for first responders and no-sew or sewn fabric masks for the community. This has been up and running for about 3 weeks now, and what we are doing at the moment is having library staff diverted to this project. It's working well. We are running low on supplies. So this supply list is on our website. If I could ask your assistance in pushing that out, we would like donations of any or all of these supplies. This is everything from sheets and t-shirts and bandanas to make the fabric masks, to HEPA filters, not fiberglass, to insert in the masks, bags to deliver the masks, and filament for the 3D printers. For the ones we're 3D printing, we recently brought over Salinas Public Library's 3D printers. So we now have many 3D printers running. What we need is the filament to print the masks. They can be dropped off or they can be sent. Please drop off under Dr. Moreno's orders. We don't want people unnecessarily on the road. But if supplies can be dropped off or mailed, again, this address is on the library's website and all this information. But I can have library staff printing and making masks as long as we can provide them with the supplies to do that, and they are beginning to run low. Any further information, please just go ahead and give me a call or shoot me an email. I'd be happy to answer further questions or put you directly in contact with our mask making team or our library team to assist. And thank you so much for giving me just a few minutes on your press time today. The phone number here, 883-7555, is the number answered live by our library staff, 10 a.m. to 6 p.m., English and Spanish, Monday through Saturday. And our website is emcfl.org. Thank you so much for giving me a few moments, and I'm here for any questions.
Thank you very much, Hillary. That mask making process is amazing. It's great to watch. We're still working on trying to determine, Chris Donnelly from WIB is on the line, but he's also on a cell phone, and I'm not sure how to get him just yet. While we're waiting to work that out, let's go ahead and start with questions that you might have, and I'll start with some of the questions that we've gotten in on chat. And this first question is for Dr. Moreno, and it's in regards to the face mask possible order. You spoke to the Santa Cruz, San Benito, and Bay Area counties have all imposed a face mask requirement. You said you were actively considering a similar order. What is the rationale and criteria for considering such a requirement, and what potential rules could be included?
So this is would be consistent with the state health officer's guidance on using covering our face. The rationale is that an individual who has to leave their home to provide or receive essential services may come in close proximity to other people while they're outside of their home. And we know that there are people who have COVID-19 virus. They're infectious, but they don't have symptoms, either because it's the 2 days before onset of symptoms that we know people are infectious, or maybe that for a longer period of time where they're infectious, but they never are going to develop symptoms because it's a very, very mild case, but they're still infectious. So knowing that there are people out there that are potentially spreading virus, though if we cover our face, then it decreases the likelihood that an inadvertent cough or sneeze will spread to someone else. So if I wear a mask and I'm out waiting in line at a store, then and I happen to be infectious and I feel fine, but I'm happen to be infectious, and I cover my mouth and I laugh, I sneeze, I cough, I have allergies, so I sneezed, for example. At least the droplets with the virus will be caught in my mask and won't get into the air and spread to other people. So the mask is intended to prevent spread. It's not intended to protect you from sneezing. So that's why people still need to shelter in place and only leave their house for the exercise, that type of exercise that's included in the health officer order, and also to provide or receive essential services. So they work together, but covering the face is not a substitute for social distancing and sheltering at home.
Thank you, Dr. Moreno. I'm going to try Chris Donnelly again and see if I can unmute him. Chris, can you join in on the call? Okay, I'm not hearing him, so let's go on to our next questions. Here's a question from the Monterey County Weekly. Is it true that 2 employees of a local Walmart have been tested positive for COVID-19? And I think that one is for you, Dr. Moreno.
Okay, yeah, thanks. So I want to remind people that, folks on the call, that that again, COVID virus is circulating in our county, and it's in all of our cities. So every time that we leave our homes to go out into the public, we are running the risk of either becoming exposed to COVID-19 or running the risk of exposing someone else to COVID-19. So I can confirm that we, since we started investigating confirmed cases of COVID-19, we have had patients that work in a variety of essential business settings, which includes large department stores. So what we do in those instances is that we confirm that the person is employed, where they're employed, and again, we have had some instances of employees in large department stores. We also then determine who was exposed, who the person thinks they're exposed, and then we also our protocol is to attempt to contact the employer so that the employer can know. We need to tell the employer who the employee was, so that the employee can go back and look at the shifts that that the person had and where they were working and who might have been around them, so that we can work with the employer to identify contacts in the work setting as well as the person's private setting. So we then will make recommendations to quarantine workers if they're not essential workers, like healthcare workers, and the department stores. In this case, it's an essential business, but they're not. The employees don't have to be at work. So the employee at a large department store who has COVID would be told that they need to stay home and quarantine until, isolate until my health department staff clear them from isolation. So that's what I can confirm.
Thank you, Dr. Moreno. And here is another question for you. There are many more cases in the Salinas area that, according to your statistics, started 2 weeks ago when the shelter in place was already 3 weeks old. What is causing that increase, and what can you do to stop it? How do you think that? I think this is a similar question to Monday, that we had on Monday.
So actually, thank you. I do anticipate we're going to continue to have more confirmed cases in Monterey County. We're in a pandemic, so it's going to eventually infect a large proportion of Monterey County residents. What we're seeing in by region is again quite a percentage of the cases coming out of the Salinas area. And speaking with my epidemiologist, it appears that, or we know that, even though all the hospitals are testing and serving their communities, there's Salinas, unlike the other areas, have two hospitals providing services. I know they're not providing services just in the Salinas area, but a lot of their patients come from the Salinas area. So they got two hospitals, two emergency departments, each very busy with in their emergency departments collecting specimens and sending them to us. So that region has more doctors swabbing than the other region. So we would expect to see, for that reason, I would expect to see more cases. What we're trying to do is slow down the spread. We can't stop the spread of a virus like this during a pandemic, but we can slow it down. As I mentioned, the containment efforts are very important, which is testing, identifying people who have it and isolating them, and then quarantining their people who are in close contact with them will also slows down the spread of the virus. And then the mitigation factors, which is what do we do to prevent the likelihood of exposures broadly through the community. And that's why people need to stay at home and only leave their homes if they're seeking essential services. They're going to provide essential services. And then the upcoming face mask order will add to that. So those are quite a few things we're doing. And the community plays a big role in all of this. The adherence to shelter-in-place orders, adherence to other health office orders, and adherence to state and federal guidance to prevent the spread of disease is very important.
Thank you, Dr. Moreno. I think someone has their microphone open. If they could mute it while people are speaking. Dr. Moreno, this is a question for you on, you talked a little bit about contact tracing. Where do we stand on contact tracing, or even planning for contact tracing timeline for a more robust program? Is it expensive, labor intensive? How would it be funded?
Yeah, so thank you. So the contact tracing begins with reporting. So doctors in Monterey County are required to report suspected or known cases of COVID-19, and laboratories are required to report all test results for COVID-19. So again, this begins, the containment effort begins with testing and reporting to the health department. So far, we've been able to reassign staff from our public health nursing programs. So the programs that provide case management to some of our vulnerable populations. At this point, some of them have been moved over to help with the contact investigations. We've also been able to move some additional staff to that unit as well. And up until now, we've been able to keep up with that. We do recognize that as we have more cases, which we expect, we will need more staff. So we continue to implement our strategy of reassigning staff. And so we've identified some additional staff from within the Public Health Bureau that will be reassigned very shortly to the unit that's investigating the cases and the contacts. So the cost of this, these are all, thus far, these are county or health department employees. So the expense has already been budgeted. We're not hiring new people, we're reassigning public health staff who are also considered disaster service workers, so they need to be reassigned to where we need them to respond to this emergency. The actual funding, we have a variety of funding streams, and that's our finance team is guiding us on how to document the time spent so that we can make best use of not only our local dollars, but any potentially future federal or state reimbursement for our response to this disaster.
Thank you, Dr. Moreno. And here's another question for you. Have you and other senior county leadership been tested for COVID-19?
Oh, okay. So I can't, even if I did know, I can't share that information because that would be a violation of privacy. So I can't answer that question.
Thank you. And here's a question about the doubling rate that you spoke of during your presentation. Why would going from 2 to 4 cases in a day or to be worse than an increase of 17 cases in a single day? Doubling rate would be much quicker for the first scenario than the latter, but the overall infection rate would be much higher. How does that indicate whether the shelter-in-place order is effective?
So we look at, first of all, we look at we don't look at a single day. We look at how long it takes for the number of cases to double. So if we had, start at a given point, we had 10 cases, the doubling rate would be the number of days that pass, that have passed when you have 20 confirmed cases. And if we start with 20, then it would double when we have 40 cases. So that's how the epidemiologists measure the doubling rate. So if we're successful, if we're doing a good job with social distancing and these other mitigation measures, then we actually want the number of days that pass before we double to be as long as possible. That indicates that the virus is still spreading, but it's not spreading as fast as it's spreading slower than if we're not providing any social distancing or adhering to shelter in place.
Thank you, Dr. Moreno. Here's a question about congested living arrangements and the virus. Can you speak about the connection between overcrowding and the spread of the virus? Is that a connection to the incident rate of positive persons in Salinas? Salinas may have more hospitals conducting tests, but it also has a larger percentage of overcrowded housing than the peninsula.
So yeah, thanks. So the number of let me back up. So again, whenever we leave our homes, we're running the risk of getting exposed or exposing someone else. So if there's no COVID-19 in a home, but people are leaving the home and getting exposed and they come back, they're now in an incubation period. And if they become infectious, now they can be spreading it within the home. So again, it's really important that people not leave the house unless there's essential business or activities that you need to do. But once it gets into a home, if there's what really matters, I believe, is whether or not when someone becomes sick, whether or not they can isolate themselves. Sure, there might be a couple of days of exposure, but even then, it's still important to isolate someone if they're sick. And so, crowded living arrangements usually result in many people living in a single dwelling, and there are often maybe just one bathroom. And so if you've got a large family living in a house, there's only one bathroom. If someone becomes sick with COVID and they are needing to isolate themselves, they may be able to isolate themselves in a room, but then they have to go use the bathroom, and everyone else has to use that bathroom. So the rate at which, so that is how crowded living could lend itself to a greater chance of ongoing transmission within a home.
Thank you, Dr. Moreno. Here's another question for you. Do we have a number yet of how many people have been asked to quarantine as a result of coming in close contact with someone that has tested positive? The last number was back when cases were at 87 and 550 were quarantined.
Sure. So the number I was provided yesterday by our epidemiologist was 725 contacts we do. There are some individuals that we, so those are the number of people that we would have, that we identified that should be in quarantine. Unfortunately, sometimes the information that we get on these contacts is wrong. We're given a number that doesn't exist, or it's a wrong number. And so we can't, even though we try to get to all 725, we can't always make contact with everyone that's considered a close contact. So the most recent number is 725.
May
I'm
I?
sorry. Were you, Dr. Moreno, I think I might have been on mute without knowing it. Do you know which hospital in Monterey County has the highest number of COVID cases?
Highest number.
You accidentally muted.
Actually, I don't know which hospital has the highest number of COVID cases.
All right. Thank you. And Mark, I think you were trying to ask a question.
Yes, I've got a couple questions. Doctor, you had mentioned that that there's been a lot of testing done at the two hospitals in Salinas. Do you have the actual number? I was looking at the daily situation report. It shows 2,430 tests received. Could you break that down between tests that are conducted in the Salinas Valley versus tests conducted on the Monterey Peninsula, if that's possible for you? And then I have a couple other questions for you.
Yeah, as far as I think Dr. Gray, I think Dr. Gray has the numbers of tests that that they've submitted. So maybe contact him. And what was the other question? Sorry.
Okay, a couple others. These came in from listeners. What are the exact qualifiers a person confirmed to have COVID-19 can be admitted to a hospital? The listener's understanding was that most patients are just sent home to quarantine in place. Also, as more test kits become available, what qualifiers does a person need to present to have a nasal swab administered?
Okay. In terms of hospitalizations, that depends. That's a clinical decision by a licensed healthcare provider. It's not a decision. That's nothing I can do to tell a physician how to practice medicine. That's a decision they have to make. And so, but typically what they would use are signs that the person is at risk of respiratory failure or exhibiting respiratory failure. And so again, that's a decision that a clinician needs to make as to whether or not to admit somebody. In terms of the criteria that are used to prioritize people for testing, we do have criteria now in place with the hospitals, and again, they are priority is given to individuals that are going to be hospitalized because the hospital needs to decide quickly if they're going to isolate the person because they think it presents COVID, but they need to know quickly whether or not it's COVID or not, so they can, because if it's not COVID, then they can release them from isolation and save their personal protective equipment for other staff who are caring for other COVID or suspect COVID patients.
And how
right
about
now, right now, our laboratory and the combination of our laboratory and the hospital laboratories have allowed for some of the hospitals to collect specimens on individuals who aren't healthcare workers, aren't being admitted, aren't first responders. And so fortunately, we've still been able to keep up with the demand from the hospitals that are sending some additional swabs. And I'm grateful that they are sending a few more, but the current priorities haven't changed. And those are strictly enforced if the demand for tests exceeds our lab testing ability countywide.
All right. And then, so as far as prioritizing, somebody who presents as, say, an at-risk group like a diabetic, or maybe someone with a suppressed immune system, immunodeficiencies, are they going to have any prioritization to be able to be tested?
You're on mute, Dr. Moreno.
Sorry about that. So that would be up to the treating physician. That would have to be on a somewhat on a case-by-case basis. And so there's still some discretion that that a practicing clinician needs to practice in deciding who to swab. We are interested also in getting some testing in among homeless individuals and farm workers, because they live in congregate living facilities, and so either congregating in a homeless encampment or congregating in some type of employee housing. So as much as possible, we'd also like to have some tests done on individuals who are symptomatic, who come from groups like that, because if they're positive, we would want to make some type of attempt to, we want to, when we call upon them, we'll see if they can isolate themselves, and if they can't isolate themselves, then find alternative housing for them while they're infectious and in their isolation and in isolation.
Thank you.
Thank you. Dr. Moreno, here's a question for you. According to the numbers, the Monterey Peninsula has only had a handful of COVID-19 cases since the beginning of April. Would you consider relaxing the shelter-in-place order on the Monterey Peninsula earlier than other parts of the county that have seen many more cases? And if not, why?
So the shelter-in-place order is intended to protect everyone in Monterey County. If we have if we use different criteria for the extent of shelter-in-place and social distancing in one part of the county compared to other part of the counties, that would have some consequences. So right now, those consequences could be people having a false sense of security that it's not in their community, and people wanting to go from one part of our county to another part of the county. So if I lifted restrictions in one city, for example, then people from other parts of the county that still have COVID-19, that also have COVID-19, could start traveling to that city to enjoy the loosening of restrictions. So we would have, I could have a negative impact on any city that is under a different level of restrictions. So the entire county is under the same restrictions, under the same shelter-in-place order.
Okay, I'm sorry, my mute button's a little finicky here. Dr. Moreno, are we seeing an uptick in farm worker cases?
So we have identified COVID-19 in employees from a variety of industries, including farm workers. As I mentioned earlier, the issue with and the numbers are, again, I know we're up to 115. You guys are probably wondering how long am I going to say the numbers are low, but they're still, for statistical purposes, they're still low numbers for statistical purpose. I do acknowledge that those 150 people probably some of them felt very, very sick. So I don't want to diminish that fact, but for statistical purposes, 150 is still a small number. And so I wouldn't be able to say that there's a peak or a trend or a spike in any particular demographic or occupational group at this time. But the concern with farm workers is that some of them may struggle to be able to isolate themselves and not infect their family members, or not infect coworkers if they're living together with coworkers.
Thank you, Dr. Moreno. Here's another question in terms of congregate living. Why wouldn't homeless residents living in encampments who have COVID-19 or been exposed be able to voluntarily isolate themselves? And that may be a question either for you or for EOC.
I could probably start the answer, and then if someone from EOC is still on, they could probably add to it. But that's again a case-by-case basis. So we'd have to, in contacting a homeless individual, we don't assume that they can't isolate themselves. A homeless individual might be temporarily in a shelter, for example, or just recently admitted to a shelter, and working with the shelter staff, if they can isolate the person, then great. But if the person, so we have to handle it on a case-by-case basis. We're not going to assume that every homeless individual can't isolate themselves, and we're not going to assume that every farm worker can't isolate themselves.
Thank you, Dr. Moreno.
And the rest of, and then after,
yes,
is
go ahead.
anyone from EOC on?
I don't think so, and
Okay.
we can forward that. I can forward that question to them.
Well, I would just add in, this is Charles McKee.
Oh, thank you, Charles.
Yes, I mean, I just would add in, it's, I think there's some common sense that goes with that. It's obviously going to be, if they're in a shelter, that, there are opportunities, as Dr. Moreno said, but if they're living in an encampment or somewhere else like that, I think it's obvious that it's going to be more challenging for them to be isolating themselves.
All right, thank you. And then we have a question, and I think this might be for you, Dr. Moreno, in terms of follow-up for positive tests. You said that people who work in department stores have tested positive. Did the stores that were involved perform a deep cleaning? And if not, why not? Or do you know what their process was?
So I believe there is guidance for businesses. Well, I know there is guidance for businesses. I think that the last time I looked at it was out of the CDC on how to prevent a spread of COVID-19, and there's guidance for cleaning as necessary, and then fortunately many of the larger businesses have implemented their own protocols as well, and I've been having been involved in some of these investigations, been fortunate to learn about the protocols that are implementing national guidelines, and I'm pleased that some of these businesses have implemented protocols for not just preventing spread of disease, but what to do if there's someone associated with the business who has COVID-19. So they are implementing guidance for cleaning and sterilizing locations that may have that a person with COVID-19 may have been near, or surfaces they may have been using.
Thank you, Dr. Moreno. And Adriana Frederic has her hand up and has a question.
Yes, thank you, Maya. Thank you, Dr. Moreno. It wasn't very clear to me. Did you mention that the use of masks are mandatory? Are you planning to suggest that ordinance? That's number one. The second one, there's some countries that are being in charge of cleaning the streets. Is there any possibility that Monterey County will start doing deep cleaning around streets or the areas that have more population? Thank you.
So as far as masks, our three counties of San Benito, Santa Cruz, and Monterey, our health officers of three counties are planning on releasing health officer orders for face coverings, and again, the benefit is if an individual covers their face while they're infectious, they're less likely to expose other people who are still susceptible to the virus. And again, that is not a substitute for staying at home and social distancing. It's meant to complement and add to an additional strategies to slowing the spread of the virus. And then as far as street cleaning, I haven't had any, I haven't seen or read anything out of the CDC or California Department of Public Health recommending routine street cleanings in any community. And so that hasn't been a topic of discussion.
Thank you, Doctor.
Thank you, Adriana. I have no more questions in chat and no more hands raised. Is there anyone who has a question before we end in about 5 minutes?
Yes, May, I actually did have a question. This is Kelly Nix.
Thank you, Kelly. Go ahead.
It is, let me go down to it. It's about Dr. Moreno's direction to the Monterey County Association of Realtors. They reported this week that the county said they could show homes as an essential activity related to a sale as long as all the furnishings in the homes have been removed and the property is vacant. Could you please explain the logic in that? And wouldn't the risk of being exposed to COVID-19 through contact with home furnishings be much less than exposed to the virus at the supermarket, for instance?
Sure. So what the health officers recognize is that there still is a need for people to move, to relocate, and they need to rent, they need to lease, or if the opportunity is there, to purchase a home. So in order to, most people will need to look at the rental, look at the property before they financially commit to a mortgage or a lease agreement. And who needs to relocate? We have, my understanding, there are some people who have relocated to help out with some of the COVID response. And if we get to, at some point, are at a peak of COVID activity and the hospitals are needing more healthcare workers, they'll have to stay somewhere. And so if they're going to be here a while, or if we have people who are going to relocate because they got a job offer, they graduated from nursing school, they graduated from the residency in internal medicine or pediatrics, and we still need to hire doctors and nurses. And so we definitely want to allow people to accept job offers to come work in our hospitals and our clinics. And so they'll need to look at properties and make long-term commitments. So how do we do that and not and minimize the risk of spread of COVID virus? So as I explained to the Association of Realtors, they can, according to the shelter-in-place order, they need to do everything as possible virtually. So all the documentation should be done virtually and not in paper with wet signatures. They need to, as much as possible, show properties virtually to those that are interested or prospective buyers or renters. But there's still a time where they need to view the property. So the requirement is that the house not be, the owners are not residing in the house. The reason we don't want the owners living there is because if they show a home to someone, that person comes in and is infectious and coughs on counters, for example, and then they leave, and the homeowners come back and don't know where the people were, and we've got surfaces that could be contaminated. So the fewer surfaces in a dwelling, the better. It's easier to clean and sanitize after showing a home, much easier than if you've got a lot of surfaces from furniture and bookshelves and other things in the house. So when they do show a home, though, it has to be no more than only one realtor or a representative of the seller, and no more than 2 people from the same household can come into the home and view the property, and they have to maintain social distancing while they're showing the home.
Thank you, Dr. Moreno. And then Kate Samini from the Californian has her hand raised. Go ahead, Kate.
Can you hear me?
Yes, I can.
Great. And I just want to apologize right now if you guys hear snoring. It's not me. It is the dog I'm fostering. I had a question for you, Dr. Marino. You had said that there isn't really a trend at the moment in, farm workers versus people working in department stores being diagnosed with COVID-19. I'm wondering if, as the shelter-in-place edict has worn on, that medical professionals are starting to see, as has been reported elsewhere, that essential frontline workers are now comprising the majority of their patients, as opposed to people who have been able to work from home and, just have a little more social distance.
Unmute.
Are we seeing, so are you asking that if we are seeing a growing proportion of people that work in essential businesses that are testing positive compared to those who aren't working?
Mm-hmm. Or who are working from home?
Or working from home. Yeah, thanks. I don't know if we have that I don't know if we have that data. I can tell you that when we do investigations, we ask for occupation, but we actually collect a lot of information for the state of California for surveillance purposes, but I don't think where they work, the circumstance of where they work is something that's collected in California. It's just and reported. So it's not something that I could. I don't think it's something that I could run a report on, but we do have anecdotal information, meaning as we from each of our disease investigators, meaning they do need to know where someone has been, so that they may know that they work for a company, and they may know that they work at home or work in the office setting. But again, that's not that. There's a lot of other information that we collect, but it's not collected in a manner that's reportable to the state of California. So I don't think I would be able to answer your question.
All right. Well, thank you very much.
Sure.
Thank you. And Kate, please post photos of the foster dog. We're after the 1 o'clock hour, but I have one more question for Dr. Moreno, and then we'll have to cut it off there. You mentioned that it's natural that Salinas would report more positive cases because there are 2 hospitals, but the county charts report that only 223 people have been tested in all the hospital labs in the county. Are the hospitals farming out lab work to other labs?
Yes. So hospitals are also sending tests to commercial laboratories as well. So what we have on our website shows, I think, test results. About 405 tests have been sent to commercial labs as well, and 223 have been performed at hospital laboratories. So, and that reflects the fact that the number of facilities that can perform tests is increasing. The type of facilities are more diverse now, as more facilities, either private, commercial, government laboratories, are getting equipment, training on the equipment, validating testing, and getting reagents and test kits to actually run the tests. So I'm grateful for that.
Thank you, Dr. Moreno. And we're well past